Hello, this is Ben with Helping Services for Youth and Families, and today we have Jen on our prevention team. Welcome.
Hi, Ben. Thanks for having me.
Yeah, thanks for being here. If you could just start it off by introducing yourself a little bit.
Sure. I'm Jen Stolka. I live in Wadena with my husband and my two boys. I'm going to have a senior this year and a sixth grader. So big changes at our house, it feels like. Went to Iowa State for 4 years and then ended up going to UNI and getting my health promotion education degree. Okay. So go Cyclones, though. So, yeah.
Well, wonderful. That's good. Well, I'm sure you kind of had to adapt into teacher mode, I guess, with your kids, with COVID and everything like that. So
yeah, it was definitely interesting. In the high school, they ended up having required work. So
okay.
Grant really did have to buckle down. Yep.
Yeah, well, that's good. Well, I guess you gained a lot more respect for teachers, because
very much
into what they have to go through. So I wonder, could you talk a little bit about your role here at Helping Services?
Sure. So right now I work under Drug-Free Communities grant. It's a federal grant in Delaware County. So I'm in the Manchester office. I've been with Helping Services for 11 years and then been in Delaware County for the last 10. So it's a substance abuse prevention grant that works on developing the local substance abuse coalition while working on, they focus on alcohol, marijuana, and methamphetamine here in Delaware County.
Gotcha. Yeah, those the coalitions that your entire prevention team works with is very impressive. It's it'd be easy just to go by yourself, but it wouldn't be very effective or wouldn't have advocates in the community. And bringing people together to decide on certain things is not easy, but you guys do a lot of work on that. So it is wonderful. Well, how did you kind of start working in prevention and things like that in that career?
Sure. So right after I graduated from college, I actually worked for Helping Services for a year. They had a coalition in my community, and Helping Services had brought in a grant. So I helped them finish out 1 year on that grant and ended up coming back. But yeah, that's how I got introduced to the work. Is we started a local coalition, a substance abuse coalition. Okay. So that's how I was introduced to the world. And then in 2008, Helping Services had a position open, and I found it interesting. So
wonderful.
Here I am.
Well, wonderful. We're lucky to have you. So there's been a few staff who've been at Helping Service for a year or two or something, went away and then came back, and it's always impressive. I guess it's a Helping Services really impacts a lot of people, and it does. If it's your career or otherwise, it's
right.
Well, what is one thing you'd want people to know about your work that they may not know by just knowing your job title or things like that?
Sure. I think coalition work is confusing to people. Like you mentioned, you can't make community change without having the locals on board. So I would like people to know that prevention work is a very slow process. You cannot create community change in a year or two. Even if you do have key stakeholders at the table. Prevention is a very slow process. And I think people do just need to realize that when people step up to work on this, it is for the better. We want to live in, safe and healthy communities, and mobilizing a coalition will do that.
Yeah, no, that's wonderful. I mean, I think you really highlighted that you can't make change in a couple months or a couple years, especially by yourself, let alone with a group of people, especially key stakeholders. So it's it is amazing work that you can't just see the next day like, oh, I changed X, Y, and Z. It's a little bit more.
Right.
If someone was interested in either serving on your coalition or finding out more information, how they can be assisted, if they're not full-fledged on the coalition, but just how they can help the work that you're doing.
Sure. So we're really trying to push out our social media. We have Facebook and Instagram, and we're called the Delaware County Drug Abuse Coalition, but our initial is DDAC. So, and they can visit our website at ddacprevention.com. And we have membership forms, and of course, give me a call, and I'm happy to go to coffee or something like that, and fill people in on how they can get involved.
Well, that's fun. Well, and I know on the Helping Services website at helpingservices.org, we have information about our coalitions. I think they're direct link to all the different coalitions. So if you're in Delaware County, obviously you can find yours. But if you're in a different county in Northeast Iowa, here we serve 8 counties. So our prevention team is all over. So you can find that there. So that's wonderful. Well, do you have I know you were talking a little bit of how slow change can happen. Do you have a success story or, over the last year or 5 years or whatever, 10 years, that has kind of taken that you're really proud of?
So I have a great group of people in Delaware County. I have people who have been here twice as long as I have that are still working with the coalition. We have some key stakeholders who they stick with it. And it's hard to sometimes stick with it because, like I said, change doesn't come easy, especially when you're trying to change a culture. So I think the success story here is the longevity of people sticking with the issue. And then even through this, pandemic, I've had great attendance on Zooms, and people just truly care in this community. So I think that's a pretty big success.
Yeah, that's wonderful. Well, you talked a little bit about COVID. How has COVID changed your work?
Well, we've always been taught you can't do prevention behind a desk. So it's been... You're
figuring how to do that, I guess, yeah.
Yeah, we're learning how to do that. But I think this was a good time also for us to kind of sit back and look at the big picture and find out where gaps maybe were that we had maybe just in our everyday work we've missed out on. One thing I've been able to really dabble into the website and get it up to date and things like that. So, there's always those projects you push aside because you are going out and having meetings or going to trainings or hosting trainings. So we adapted. I think we all did pretty good. So
that's good. Well, I think, you kind of highlighted it there as obviously no one wanted COVID and no one wants it here, but it is here. So it's how do you take that as a blessing in disguise and be able to do different things or figure out or review the way you do things. It's I think every business is probably doing that, not just us at Helping Services, but so that's wonderful that you've kind of taken that and done that. So, well, and then on a lighter note, more about you is I like to figure out, do you have a special talent, skill, interest, hobby that people may not know about you?
I do have a side job, and my side job is I run the North Fayette Valley Mentoring Program. Kids who have a mentor are less likely to engage in risky behavior. So that's my little side gig is I run our program in my local school district.
No, that's wonderful. That's wonderful. Yeah, I know and we do have mentoring there in Delaware County as well. So we just actually hired.
I get to be a part of both.
Yeah, so that's wonderful. That's wonderful. That's also not a quick process to make change. It's that's a testament to you and your longevity there for pushing things through. So wonderful.
Thank you.
Yeah. Well, Jen, thanks so much for spending a little time with us today. It's been fun to get to know about your work there in Delaware County. And if people want to know information about the work we're doing in Delaware County or anywhere in Northeast Iowa, you can go to our website at helpingservices.org or just shoot us an email at info@helpingservices.org and we'll find you the right person to talk to in your area. So thanks so much, Jen.
Thanks for having me. Have a good day.
You too.